Okay, let's talk about what it means if you are Rh negative and you are anticipating pregnancy or you are pregnant. Okay, when looking at someone's blood type, there are two components. The ABO system, which involves the presence or absence of A and or B antigens or proteins. A means you have the A antigen or protein present, B is absent. B, A is absent, B is present. AB, both A and B antigens or proteins are present. And then O means both A and B proteins or antigens are negative. And those are the proteins that are kind of speckling and spackling the outside of the red blood cell. The second part is the rhesus Rh system. If you have the D antigen on the presence of your red blood cells, that means you are Rh positive. If you do not have the D antigen on the surface of your red blood cells, you are Rh negative. So someone can be A negative, A positive, B negative, B positive, AB negative, AB positive, and O negative, O pos. Now, a problem can arise when the individual who is pregnant is Rh negative, but the fetus they're carrying is Rh positive. If for some reason there is a mixture of the Rh positive blood of the fetus and the Rh negative blood of the pregnant individual, that can cause the pregnant individual to recognize those Rh positive blood cells as foreign and then develop antibodies to attack the D antigen that is present on the surface of those fetal red blood cells. And those are called anti-Rh or anti-D antibodies against the Rh positive or D positive cells of the fetus. Now, the first pregnancy in which that happens is generally not affected. It's the subsequent pregnancies that can be affected. So if you get what's called Rh incompatibility in that first pregnancy, when the patient gets pregnant again, and if that fetus is Rh positive, then the antibodies are already there in the maternal circulation and they can attack those red blood cells that are Rh positive in the fetus, causing fetal anemia. And that is a very complex and very complicated condition that can be very problematic for the pregnancy. So you want to prevent those antibodies from ever developing, even in that first pregnancy. That's where RhoGAM comes in. RhoGAM is a medication that is given to the pregnant individual who is Rh negative via an injection that prevents the development of antibodies against Rh positive cells of a fetus if the fetus is Rh positive. Again, if those antibodies develop, RhoGAM is useless. So you want to prevent those antibodies from ever developing. Now, we don't always know the Rh status of the fetus, if it's Rh positive or Rh negative. That's why it is recommended that all pregnant individuals who are Rh negative receive RhoGAM. Now, if you are Rh negative and you are pregnant, the cell-free DNA screening test, which is a prenatal genetic screening test, can look for the Rh status of the fetus. So if you're Rh negative and you get that cell-free DNA test, which is also known as NIPT or NIPS, ask for them to get the Rh status of the fetus. If that status is negative, you're good. You don't need the RhoGAM. You don't need any additional testing. If the status of the fetus is positive, then you need the RhoGAM. Another thing that you can do is if you're Rh negative and your partner, the person that contributed the other half of the chromosomes of that fetus, is also Rh negative, and it's 100% for certain that that is the partner who contributed the other half of the chromosomes to the fetus, then you can forego the RhoGAM. But if there's any chance at all that that fetus is Rh positive, take the RhoGAM. Please.